Understand.
Making the decision to breastfeed is a personal matter. Although doctors strongly recommend breastfeeding, the decision is up to you and to your body's ability to do it. I have some tips for you to start breastfeeding. There are ABCs for breastfeeding. A is awareness. Watch for your baby's signs of hunger. Breastfeed whenever your baby is hungry only. This is called breastfeeding on demand. Be patient. Breastfeeding, as long as your baby wants to nurse each time, is the best thing to do. And infants typically breastfeed for 15 minutes on each breast. C for comfort. This is key. Relax while breastfeeding. Your milk is more likely to let down and flow when you're relaxed. Wear white clothes. Put your hair up. Get yourself a pillow. Support your arms, head, and neck. Listen to music. Make sure nothing is bothering you. If you want, you can have footrest to support your legs. The first time you hold your newborn is a great time to start nursing. You can be in a sitting or semi-sitting position. At the beginning, your body will produce a very small amount of special milk called colostrum. It will be enough for your baby to fill up. So don't worry about the amounts just yet. Now let's get started. Position yourself comfortably. There are several feeding positions that you can choose from. If you are in the sitting position, have proper back support. Place a pillow on your lap to help you keep your back straight. Rest your arms on it. Support your feet by a footrest if you like. And remember, having an arched back or tense chest muscles will reduce the milk flow. So relax. Position the baby close to you, chest to chest, tummy to tummy, so that he does not have to turn his head or extend it too far to reach your breast. His mouth and nose should be facing your nipple. Support the breast using a C hold. The fingers underneath, thumb on top, well away from the areola. Attach or latch the baby on your breast. Use your nipple to tickle the center of your baby's bottom lip. This will encourage the baby to open the mouth wide. Aim your nipple slightly towards the roof of his mouth, bringing the baby to you, chin first, and pull him close by supporting his back so that his chin drives into your breast. His nose will be touching your breast. Your hand forms a second neck for your baby. Good latch-on position will have checkpoints for your baby, so check that. His nose is nearly touching your breast. His lips are flanked. His mouth is covering a big part of the areola below the nipple, and your nipple should be far back into your baby's mouth. There should be no pain at all. Check if there's pain. If the latch is uncomfortable or painful, you're doing it wrong. Gently place your finger in the baby's mouth between his gums to detach him and try again. Don't panic if your newborn seems to have trouble finding or staying on your nipple. Breastfeeding requires lots of practice and patience. While feeding, keep drinking. It will help you produce more milk. After your baby finishes, or if you notice that he's suffering from his tummy, like pulls up and starts crying, it's burping time. Burping frees up room in your baby's tummy so he can settle and feed longer. It can also be beneficial for babies who spit up often. Don't bother burping your baby if she seems content or falls asleep during or after the feeding, but if you think the baby needs it, it's very important to do it. So how to burp your baby? There are different burping methods that you can try, but before trying any burping position, put a cloth over your shoulder or the place where the baby's mouth will be to protect your clothes, of course. So, there is the chest on shoulder position. Hold your baby against your chest so that his chin is resting on your shoulder. Support him with one hand and gently pat or rub his back with the other. Do this till he burps. There's another position where he would be sitting on your lap. Sit the baby on your lap facing away from you and use one hand to support his body, and the palm of your hand is supporting the chest while your fingers gently support his chin. Make sure that you're not putting your fingers around his throat. Lean your baby slightly forward and gently pat or rub his back with your hand. You can use another method with the face down across your lap. So lay your baby face down on your legs so that she's lying across your knees, perpendicular to your body if you want. Support her chin and jaw with one hand and make sure your baby's head isn't lower than the rest of her body. Pat or rub her back with the other hand. Let your husband help you the first few times with the burping and sometimes with holding the baby's head while facing the breast. If you have a premature baby, you may not be able to nurse right away, but you should start pumping your milk. Your baby will receive this milk through a tube or a bottle until she's strong enough to nurse. So how often should you nurse? Well, frequently. Nursing 8 to 12 times a day would be the best. Also discuss supplementation of both iron and vitamin D with your doctor because it's very important for you and your baby. How to know that the baby is having enough milk then? If your baby is gaining weight and seems contented after most breastfeeds, then he's fine. Also, keep an eye on your baby's diapers. In the first couple of days after birth, your baby should wet several nappies a day. He'll also pass one or more poos, called meconium, a day. Over the next few days, your baby's poos will turn from dark and sticky to yellow and soft. He should have at least 6 wet nappies every 24 hours once he's more than 5 days old. If your baby has dryish nappies and doesn't poo often, it can be a sign that he's not getting enough fluid. If you're worried that your baby isn't getting enough milk, try these steps. Feed more often. Watch for cues, turning his head towards you with an open mouth. It's called rooting. Let your baby stay on one breast for as long as he seems to want it before switching to the other breast. This allows him to get the filling of fat-rich milk that comes at the end of the feed. I wish you and your family the best of health. This video contains general information about medical conditions. The content might not be suitable for everyone and should not be treated as such. Always consult your doctor before using medications. The medical information is provided without any warranties or legal obligations to those who might apply them.